If you're on Social Security, brace yourself. A devastating $26 monthly increase is about to hit your Medicare Part B premium, and it could completely wipe out your cost of living adjustment. In this video, I'll break down exactly how this shocking 11.6% premium increase will impact your monthly benefits, why it's happening now, and most importantly, the specific steps you can take to protect yourself before it's too late. Welcome to Financial Area, where we decode the financial changes that matter most to your retirement. If this information helps you, please hit that like button and subscribe for more updates on Social Security and Medicare, because staying informed is your best defense. Let's start with the numbers that are about to change everything for millions of Americans. Just 3 months ago, experts were projecting a $12 increase in Medicare Part B premiums for 2026. That would have brought your monthly premium from the current $185 to $197, a 6.5% increase that was already considered substantial. But here's where it gets shocking. Latest projections have more than doubled that estimate. We're now looking at a potential $26 increase, pushing your monthly premium to $206.50. That's an 11.6% jump in just 1 year. To put this in perspective, this single increase affects nearly 70 million seniors and people with disabilities across the United States. These are people who depend on Social Security benefits as their primary source of income, and for most of them, every single dollar matters. Now, you might be thinking, well, at least I'll get a cost of living adjustment to help with this. Here's the problem. The projected COLA for the coming year is only about 2.5% to 3%. Do the math with me here. Your Medicare premium is going up by 11.6%, but your Social Security benefit is only increasing by 2.5% to 3%. That means this premium increase, loan could eat up your entire cost of living adjustment and then some. But here's what makes this even more devastating. Your Medicare Part B premium is automatically deducted from your Social Security check before you even see that money. So when your premium goes up by $26 per month, that's $26 less in your pocket immediately. You don't get to decide whether to pay it or not. It's gone before you can even touch it. Let me paint you a real picture of what this means. If you're currently receiving $1,500 per month in Social Security benefits and you get a 5% COLA, that's an additional $37.50 per month. Sounds good, right? But then the Medicare premium increase of $26 gets deducted automatically. Net gain, just $11.50 per month. And that's if you're lucky enough to get the full 2.5% COLA. For many beneficiaries, this scenario is even worse. Some could actually end up with less money in their pockets than they had the previous year, despite getting a so-called cost of living adjustment. This isn't what the COLA system was designed for. It's supposed to help you keep up with rising prices, not get wiped out by a single healthcare cost increase. The emotional toll of this cannot be overstated. Imagine being 75 years old, living on a fixed income, and suddenly finding out that your monthly benefits are effectively being cut. You're forced to make impossible choices between paying for medications, groceries, or other essentials. The anxiety of not knowing how much you'll actually receive each month is overwhelming. So what's driving this massive increase? The simple answer is that healthcare costs are rising faster than general inflation, and Medicare premiums are supposed to reflect these rising costs. But an 11.6% jump is far beyond what most would consider reasonable or sustainable. Several factors contribute to this perfect storm. First, medical expenses across the board are climbing at an alarming rate. New treatments, advanced technologies, and an aging population all put pressure on the Medicare system. When the cost to provide health care goes up, those costs get passed on to beneficiaries through higher premiums. Second, policy changes within Medicare can have dramatic impacts on premiums. Adjustments in coverage, new treatments being added to the program, or changes in how services are billed can all drive up costs. Sometimes these changes happen with little warning, leaving beneficiaries scrambling to understand the impact. Third, we're dealing with demographic shifts that put unprecedented strain on the system. As baby boomers continue to age into Medicare, more people are enrolling in the program while fewer working-age adults are paying into it. This creates a financial imbalance that has to be addressed somehow, and unfortunately, higher premiums are often the answer. But here's what's really frustrating for beneficiaries. There's a complete disconnect between how the cost of living adjustment is calculated and how Medicare premiums are determined. The COLA is based on general inflation measures, but healthcare costs consistently rise faster than general inflation. This means that every year, Medicare beneficiaries fall further behind, even with their annual adjustment. The current system essentially creates a situation where your healthcare costs can completely devour any increase in your Social Security benefits. It's like being on a treadmill that keeps speeding up while you're trying to maintain the same pace. Eventually, you're going to fall behind. Now, here's a statistic that might shock you. It's estimated that 90% of seniors are on the wrong Medicare plan. Let that sink in for a moment. 9 out of 10 people are not getting the best coverage for their needs and budget. This means that not only are they facing this premium increase, but they're also potentially paying more than they need to for coverage that might not even be optimal for their situation. This is where the premium increase problem gets compounded. If you're already on a plan that's not the best fit for your needs, and then you get hit with a significant premium increase, you're essentially getting a double penalty. You're paying more for coverage that wasn't serving you well in the first place. But here's the good news. You don't have to be a victim of this system. There are concrete steps you can take right now to protect yourself and potentially save hundreds or even thousands of dollars each year. The first and most important step is to get a free Medicare plan review. Even if you think your current plan is sufficient, it's worth getting a second opinion. There are over 20,000 Medicare plan options available nationwide, and the landscape changes every year. What was the best plan for you last year might not be the best plan for you this year, especially with these premium increases on the horizon. Trusted advisors can review your current plan, compare it to all available options in your area, and help you find the best fit for your specific needs and budget. These reviews are often completely free, and the results can be dramatic. On average, seniors who switch to a better plan save $100 annually. That's more than 4 times the projected premium increase we're talking about. But here's the key. You need to act now. Don't wait until you receive a surprise bill or find out too late that your coverage isn't adequate. The enrollment periods for Medicare have specific deadlines, and missing these deadlines could mean you're stuck with suboptimal coverage for an entire year. When you're reviewing your plan, there are several key factors to consider. First, make sure your preferred doctors and providers are in the network. There's no point in having coverage that doesn't include the healthcare providers you trust and rely on. Second, carefully review the prescription drug coverage. If you take medications regularly, you want to ensure they're covered under your plan's formulary and that you understand any prior authorization requirements. Third, look at the overall cost structure, not just the premium. A plan with a higher premium might actually cost you less overall if it has better coverage for the services you use most. Conversely, a plan with a low premium might end up costing you more if it has high deductibles or co-pays for services you need regularly. Fourth, consider additional benefits and services. Many Medicare Advantage plans now offer benefits like dental, vision, hearing aids, or even grocery allowances. These benefits can add significant value, especially if they cover services you would otherwise pay for out of pocket. One of the most effective strategies is simply to ask. Don't assume your current plan is the best option. Explore your choices and advocate for yourself. Ask about discounts. Ask about additional benefits. Ask about alternative plans. You'd be surprised how often you can save money or improve your coverage just by inquiring. The power of asking extends beyond just plan selection. If you're struggling with the cost of your medications, ask your doctor about generic alternatives. Ask your pharmacist about discount programs. Ask your insurance company about prior authorization exceptions. Many people miss out on savings simply because they don't know. To ask, or they assume the answer will be no. But your action plan shouldn't stop at plan selection. You also need to stay informed about future changes. Medicare policies, Social Security rules, and healthcare costs are constantly evolving. Subscribe to trusted sources, join community groups, and don't hesitate to ask questions. The more you know, the better equipped you'll be to navigate these challenges. Consider connecting with local resources as well. Many senior centers offer free counseling and assistance with Medicare and Social Security issues. These services are often provided by trained volunteers who understand the system and can help you navigate complex decisions. They can also alert you to changes or opportunities you might otherwise miss. Advocacy is another powerful tool at your disposal. Contact your elected officials and let them know how these changes affect you. Share your story and urge them to consider the real-world impact of premium increases on vulnerable populations. Individual voices might seem small, but when multiplied across millions of beneficiaries, they can create real change. Join or support organizations that advocate for seniors and people with disabilities. These groups work to influence policy at the federal level and can help ensure that the voices of Medicare beneficiaries are heard in Washington. They also provide valuable resources and information to help you stay informed about changes that affect you. Don't keep this information to yourself. Share it with friends, family, and neighbors who might be affected. The more people who are informed and taking action, the better prepared everyone will be. Many seniors benefit from informal support networks where they share information about plan changes, policy updates, and money-saving strategies. Remember, the current premium increase is still a projection. Stay tuned for the official announcement, which typically comes in the fall. However, don't wait for the official announcement to start preparing. The time to review your coverage and explore your options is now, while you still have choices available. It's also important to monitor your benefit statements carefully. When changes do go into effect, make sure you understand exactly how they're impacting your monthly benefits. If you notice discrepancies or have questions about deductions, don't hesitate to contact Social Security or Medicare directly for clarification. He projected Medicare Part B premium increase is more than just a line item on a budget. It's a real and pressing concern that affects your daily life and financial security. While the situation is frustrating and, at times, overwhelming, taking proactive steps can make a significant difference. By reviewing your Medicare plan, staying informed about policy changes, and advocating for fair policies, you can navigate these changes and ensure you're getting the benefits and care you deserve. Remember, you're not alone. Millions of others are facing the same challenges, and together, your voices can make a difference. The key is to stay proactive, informed, and connected. Take charge of your benefits, support your community, and continue to advocate for a fair and sustainable system for all. Your future self will thank you for taking action today. If this video helped you understand the upcoming Medicare changes and what you can do about them, please give it a like and subscribe to Financial Area for more updates on Social Security, Medicare, and retirement planning. Your financial security depends on staying informed, and we're here to help you every step of the way.